Hi, my name is Paige, and I will be giving a report off on Aiden. Aiden is an 8-year-old boy that presents to the clinic today with his parents for follow-up on his ADHD evaluation. His parents report that they continue to notice difficulty with focus and impulsivity with Aiden, both at home and at school. They report his teachers describe him as blurting out answers, fidgeting, and needing multiple reminders to stay on task. At home, they note he has trouble sitting through quiet activities and needs frequent prompting to complete chores. His parents are looking for ways today to help him focus and be more successful in school. Overall, his background, Aiden is a healthy child with no significant medical or surgical history. He lives with both parents and his older sister, and they report a stable, structured home life. He sleeps well, gets about 8 to 9 hours of sleep each night, and has pretty limited screen time. Family history is notable for his father reporting difficulty with concentrating as well and high energy, though he never has been formally evaluated for ADHD, and a maternal grandfather with depression. For my assessment during today's visit, Aiden was pleasant and cooperative, but noticeably fidgety, and he interrupted a few times during my assessment. The Vanderbilt ADHD rating scales completed by his parents and then two teachers was reviewed. So both parents and one teacher endorsed symptoms consistent with combined type ADHD, and the other teacher noted predominantly inattentive type features. So based on these findings, Aiden meets diagnostic criteria for ADHD combined presentation. So some pertinent positives include inattention, impulsivity, hyperactivity, and functional impairment across settings. And then some pertinent negatives include he has stable sleep, no real anxiety symptoms, and no signs of depression or learning disorder. But some of my differential diagnoses included oppositional defiant disorder, anxiety, or learning disorder, but these are less likely just given his overall presentation. So my recommendation for treatment, I would recommend starting methylphenidate extended release or Concerta, 18 milligrams by mouth once daily in the morning. So according to the American Academy of Pediatrics and Lexicomp, the dose can be titrated weekly up 18 milligrams as needed and tolerated to a maximum dose of 54 milligrams per day for children. So this would allow for some gradual adjustment just to kind of reach that optimal control for him while minimizing some side effects. I discussed some of the common side effects like decreased appetite, GI upset, and some potential sleep disturbances. So just advised his parents to kind of continue to monitor his appetite, weight, sleep, and mood. So in addition to medication, I recommended a referral to behavioral health, both for Aiden's parents and for behavioral therapy for himself. So evidence shows that combining behavioral therapy with stimulant medications just provides the best outcomes for children with ADHD, and that was seen by the CDC. I also encourage the parents to coordinate with Aiden's teachers to create more structured routines and consistent expectations in the classroom settings. I would like to follow up with Aiden in about 2 to 4 weeks to assess medication response and any side effects, and then just to adjust the dose as necessary based on his clinical response and tolerability. Thanks.